Hi, my name's Sanzi. My topic is economic burden low back pain places on nurses. I'm a pre-health professional focusing in on kinesiology and planning on continuing on to chiropractic school. Prevalence of low back pain is extremely high. According to the American Medical Association, 8 in 10 people will experience low back pain sometimes in their life. Low back pain is an economic burden on Americans it affects. According to the Spine Journal, low back pain in the United States, including direct and indirect costs, range from $84.1 billion to $624.8 billion. Low back pain is a common disability. In 2005, the U.S. Census Bureau reported spine and back problems as the second most common cause of disability. Nurses are among the highest occupation to report low back pain. According to the Center of Disease Control and Prevention, nursing aides and orderlies suffer the highest prevalence, 18.8%, and report most cases, 269,000, of work-related back pain. And last, according to the Journal of Advanced Nursing, studies have shown that nurses are among the highest work-related low back pain injuries. According to nurses, leading to nurses are placed at higher risk of low back pain, putting them in a tough economic spot. Currently for this problem, they are providing training for nurses on the proper body mechanics, but they are not being reinforced. They are also doing ergonomics, which is how the work environment is set up. Again, this is not being reinforced. According to the back injury among healthcare workers, studies show patient lifting and transferring as a major risk factor of overexertion injuries, also including awkward lifting position, weight of load, distance from the center of gravity, confined workspace, and continuously reaching and bending. My solution comes in 3 parts. It would first be mandated by the hospital administration. The first part would be screening. This would happen before hiring. The first part of it would be test their skill level. Make sure that they use proper body mechanics. If not, it can throw off their gait cycle, which in turn shows that their center of gravity off, which is a very important part in proper lifting. Second, test their strength. Make sure they have the ability to bear weight. Don't ask them. Actually check their range of motion. The second part would be training. Things that should be going over is tell them to plan ahead, not to hurry. Feet should be shoulder width apart for a solid base of support. Bend knees and use legs. Also pull from your core muscles. Point toes and pivot. Never twist. Do not bend at the waist. Keep a neutral spine curve. Use assistive devices, such as a transfer belt. Also, teach some strength exercises. It's extremely helpful to build strong core muscles, which will help your back muscles. Part 3 would be the ergonomics, which is the work environment setup. Management must be involved to eliminate social stress factors and physical environment that prevents proper biomechanics from happening. Stress has been shown to affect lower back pain. Some examples of things in the environment that should be fixed would be the height of the bed, confined workspace, adjustable wheelchair arms. Some important factors to my solution would be repetition. People do forget. Hang a cue to action. Remind them, as the steps for proper lifting. Benefit would be lower work compensation for hospitals that decrease the percent of lower back pain injuries from the year before. Benefits for hospital management and nurses would be after 120 days of claim-free, they can have a personal day. Of course, there would be no consequences for this solution. At no point should someone feel uncomfortable reporting their injury if they feel that they will receive some kind of consequence. This solution is an external solution. The example was the cue to action, training, providing them with the information that they need to know to effectively carry out the proper use of lifting and movement. Nurses are placed at high risk of low back pain, putting them in a tough economic position. 3 parts of the solution were screening, make sure they are able, teaching, showing them how, ergonomics, make it possible. This solution will help alleviate the economic burden placed on the nurses. Providing prevention is the best method for a solution.